Hello, I don't know how to follow that.
I really don't. And I'm definitely not asking you to guess my age. So I'm definitely not starting there. So look, it is fabulous to have you all here today. I've never seen the atrium used like this before. Isn't it fantastic? I think a few of you walked in and just said, wow, this is really different to what we've done before. And it genuinely is so wonderful to have lots of familiar faces in the room together and doing exactly what Joe said, which is spending time together, getting to know some new colleagues too, I hope, but also just sharing our experiences and building on all the great things we do already together. And I'm really looking forward to spending the time with you. But I wanted to start with a thank you. A thank you for turning up, because you never quite know when people put their name down, will they come? And it would have been a bit of a damp squid if you'd all not turned up. So thank you for that. But secondly, just thank you for what you do every day. A really heartfelt thank you. I know and I see when I go out that the work that you do is just incredible. And it doesn't matter whether it's the corporate teams based here or out in every single team, you really do make a difference. I know it can be tough. I know it can be challenging in whatever role you're in the organisation at different times. I know it can be emotionally tough sometimes too. But what I see day in, day out is people showing up, showing the determination, showing the care, showing the compassion, and looking after each other and really, really wanting to make a difference. And that makes me incredibly proud as Chief Executive. In our recent staff survey, 84% of you said that patient care is our top priority. And I think that says something really, really powerful about us in terms of where we focus, where we pay our attention. But it takes great teams to make that happen. It can't happen by one individual. And that's what I think we see across the organisation. And when the CQC keep coming into us at the moment, and I announced our full inspection, didn't I, yesterday, that's what they feed back to us, that they see great teams working together, not great individuals, great teams. And that's looking after each other as much as it is looking after service users too. I saw that only last Friday, and I went and spent some time with Heather and Sarah in the street triage team. I have to say, going in a blue light car has to be the highlight of my year so far. I think we hit 124 miles an hour on the M1. I tried to look like I was the chief exec in control, but I have to say I was pushing my feet against the front of the car thinking, when will this be over? But the important thing was I spent time with Heather, one of our nurses. She was working alongside the police, supporting a gentleman who wasn't known to our services, who was incredibly unwell, delusional, psychotic. He was in real distress. And what stood out wasn't just the quality of Heather's clinical judgment in the moment, but how care was being delivered together. So relying on each other, relying on the police, liaising with the crisis team, working with the London Trust, where this gentleman had been previously a patient, bringing different skills together, really in the moment, giving personalised care for that individual, always looking in the moment about what was the best thing to do for him. And it reminded me again, really in that moment, just how much of our best work we do when we are together. I do want to go out on another blue light crawl, though. I recommend it if ever you get the chance. So, and of course, it's not just in street triage. I see it across every single team. Many of you know I go out to services every week, and it doesn't matter where I go. I see this played back to me time and time again. And I've mentioned the CQC already. They've been into 4 of our services so far this year, and some of the feedback we have had is absolutely phenomenal. In fact, most of the feedback we've had. And it's incredibly moving, and it's all about, for me, kindness, care, respect, about when people are able to tell us that they feel safe, that they feel like they're being listened to, that they feel like they're being cared for. Experts by experience who've been involved in those inspections, so not ours, others coming in, have said in all of the services that they wish their care could have been provided here. What an accolade to those teams. And there was one particular piece of feedback, and the people that work in learning disabilities will have heard me reflect this back, because it's one that's just stood with me through reading all of the reports so far. And one family described our service as a ray of sunshine in the dark. And I think that applies to each and every one of you. It applies to all of our services across HPFT. But what a thing to be able to say about the care your loved one was getting and how that felt for you as a family member too. And that's because of you. That's because of the great care that you're providing and being great together. Of course, outside of the trust and also sometimes inside, I know that the wider context can be quite tough. Demand's high, the resources are tight, cost of living's rising. We've got to manage our budgets wisely at home, don't we? The cost of our shopping trolleys has raised, but also we have to manage our resources really tightly in the organisation as well. Obviously, go bigger picture, there's war, there's some really horrible acts of discrimination, racism happening across in this country, but abroad too. And I think all of that for me reminds us there's never been a time when we need to really truly live our values. We need to truly make sure that there is a sense of belonging, a sense of inclusion, that everybody in HPFT is able to thrive and be themselves. And of course, there's lots of negative noise about the NHS. I'm going on a bit of a downer at the moment, as you can tell, but I will come back up, I promise. And you can't turn on the TV without hearing perhaps the NHS isn't doing what it needs to do, or to hearing another story about where care for someone with a mental illness has gone wrong. But there is change afoot and things are improving. And the National Mental Health Act reform that's been announced, the new modern service frameworks, I don't know if you've heard of those, but they're being developed for a variety of areas, but including mental illness. The shifts we hear about in the 10-year plan, so you will have probably become familiar with the conversation about moving from treatment to prevention, from hospital to community, and from analog to digital. And they're all shifts we're already making. In fact, some of them we've made a few years ago in terms of moving out of just hospital-based care into community. So the journey we are on is the right one. And I have to say, when I look inside, I feel hugely, hugely optimistic, hugely hopeful, because I know what you're capable of. I know what our teams are capable of. I know what we are doing each and every day. And when I think back to Joe's statistic of how many people we support, and it's phenomenal, isn't it? Over 1,000 people a day getting that level of support and contact with our services every single day. Talented teams, talented people, committed teams. And I know each and every one of us really cares about improving things. And then I look at what we've already achieved. So I can't reel off everything we've achieved, but I do have a long list in front of me. But what I would say is that it's absolutely remarkable what we've just achieved in the last 12 months, what you've just achieved in the last 12 months. I'm going to have a go at reeling off a few. I'm going to go fast. So we've brought over new community services in Norfolk, and what a phenomenal group of individuals and teams they are. Our mental health urgent care centre now fully open, new crisis house at Pendle, new wards and beds on Dove, reconfiguration, secure services, external accreditation for many of our community teams, launch of safety strategy, national awards, clozapine clinics, physical health, LD psychiatry and team in Essex, innovative research, avatars, saliva genomic testing. Chief Medical Officer, you'll be pleased I've mentioned it. Reduced restrictive practice, increased role of mental health in school teams, growth in talking therapies, more staff working with us than ever before, reduced agency use, delivered quality improvement. The money's been delivered, improved waiting times, strong assessments for leadership, quality, capability. I could go on. That's just the things I sort of sat and thought, okay, what will I say in this rapid fire list? It's phenomenal. And all of that comes down to making a difference for service users, carers, and the communities we serve. And none of that happens by accident, does it? It happens because we've got purpose, we're working together, we're greater together. And that's what today's about. That's why I'm really, really excited about you all being here. We're not going to stand still. My team, I think what words would I use? What words would they use? They know I never want to stop. Let's be really positive. That I'm always on to the next thing. I always want us to be doing even more for you as our people, but also for the people that we serve. So today is truly about hearing your ideas. It's about really hearing your thoughts. It's about being creative. It's about bringing your curiosity into the room, your challenge into the room. And I think we've got nearly 100 people online as well who are listening to this. So those people online, I'd also like you to be thinking about what else you're going to be contributing today, your thoughts, your creativity too. And let's learn from each other. I know I'll learn something today, and do take those conversations back into your teams as well. So thank you. It's a whistle stop from me, but I truly mean a heartfelt thank you for everything that you're doing. And let's have some fun today too. So that's it from me. Have a great day.